Then we understand the another point to be known as a Chung Po or Chung Cho, that is triple warmer 3 or known as a EM3. I just apply and show you where precisely that location is located. By the way, you just mark it. If you have the needle in the zoom, you just insert the needle wherever you are feeling, because my master says that whenever the person wanted to treat to somebody else, before to applying to anyone, we should know the insertion, what kind of the pain patient is feeling. Now you just try to see the SJ3 I am applying, where exactly the location. There are the one location midway between the two head of the metacarpal bones. Midway between the two head of the metacarpal bone and slightly proximal to that particular region, this to be known as a Chung Chu. SJ3 or the EM3 point.
So the depth of the needling?
Yeah, 1 chon, 1.5 chon, even you can insert the 2 chon towards the upward direction. But however, it is recommended, this is in fact is the mother point. SJ3 is the mother point, therefore it is recommended to use 1 chon to 1.5 chon slightly towards the chi flow, slightly towards the energy flow we inserted. But SJ2 and then SJ3 and both are mother and then grandmother points, right? So therefore it is regulating and communicating to the triple warmer meridian, where the chi is flow on that particular meridian. You remember, I wanted to tell you is the key information. So all of you, it is really you need, you understand, most of the patients, the people who come for the treatment connected to the head and neck region, the person who is working in the corporate levels, most of the people, 90% of the people are suffering for the triple warmer or the EM meridian chi is deficiency. Because I have the great experience that most of the times is the deficiency. The person says is the fatigueness, the person says is the lethargy, the person says is the numbness or the neuropathic condition, or the person says I do have the problem of the vertigo or the dizziness, or there is the ear related problem, otalgia, otitis media, otorrhea, or there is the wind is entered into the ear system, where the tympanic membrane is the problem, semicircular canals are the problem, vestibular nerve is the problem, the cochlear nerve is the problem, the cranial nerves having the problem. That particular time it is recommended to use the Chung Su point. There are the 2 points always is, remember this amazing point to treat for this the upper related problem. Now I'll come to the compression and summary of these 3 points. Be careful, the body also present and mind also present. Body is present, mind is somewhere, that goes the volatile, it evaporates to the sky, then again it come back. I don't know when it will come back to you, but try to focus and take it all the things. That will be really helpful. You understand the SI SJ1, that to be lower geo, then triple warmer 2, that to be considered as a upper geo. The SJ3, that means is the EM3 to be recommended to apply to the middle geo. That the entire body system, the upper geo, middle geo, lower geo, 3 junction or the 3 cavities, the entirely which we call as a triple warmer mechanism. So this mechanism has been originated immediately after the birth of the baby. This energy is encirculating to the entire system of the body. You remember at the time of the 2 months of the infant, the fetus, so that particular time all the meridians started, especially the extraordinary meridians, the extraordinary fu viscera called as a Ren Ing and also we call, you know, that extraordinary 8 meridians. Those meridians after the birth, it opens and then it scatters the chi to the entire system of the body with the support of the one meridian, that meridian to be known as the EM meridian. So therefore, you understand the Sanjio 1 to be regulated to the lower geo, and then Sanjio 2 to be regulated to the upper geo, Sanjio 3 to be regulated to the middle geo, because this is communicating to the Sanjio 3 is equal to the and Yang Fu, that is GB 38. So therefore the gallbladder is located, the liver is located on the middle geo. Therefore this is communicating to the both the meridian. That means is the gallbladder and then liver, and then all the spleen and the stomach and intestines are governing by the one particular point. That means is the middle geo is regulated by activating this point. So now you understand the Sun Chio. The name itself is the Sun Chio. The Sun means is the 3. Now the 3 junctions are communicating by the Sun Shu. This is my name to be known as a Sun means is the 3, Shu means is the Shu point. When I was studying in China, that time they told Paleo. Then I remember Paleo, I couldn't catch that, how is it Paleo? There is no name in the Paleo. That time I remembered Pa is indicating to the 8, and then Leo means is the Shang Leo, Si Leo, Xia Leo, Chung Leo. These are the 4 points. Now it taking time to me. UB 31, 32, 33, 34. These are the 4 points are located on the one side. The other side, the 4 points are located. You remember, this is the key. This is the Paleo points are really amazing. Is a great point to treat for the male and then female related disorders, which is communicating. There is a holy bone. Where is the holy bone is located? That is the sacrum. That sacrum, there is the foramina. That foramina half tune lateral to this particular point. They told me, they have given that explanation, that point to be known as a cilio. One deep needle, 3 tune needle inserted to the deeper level, communicating to the urinary bladder. Trigone. There are the holes are there. So on the sacrum level, holes are there. That through that sacrum is communicating to the urinary bladder. So therefore you remember, these are the 2 points are governing. However, I am going out of the topic. But however, this to be known as a Sun Shu, you remember is the Sun Shu is invented mine also perhaps. So Sun Shu points are the one is the Quan Chung, the second point is the Yemen, the third point is Chung Cho. Because you know that there is the communicating to all this meridian. This is not only that my perception, because this is the reality based on the Wu Xing, that is the 5 element theory. So therefore now you remember, this is in fact is the very imperative point, because day to day clinical practice, normally I touches this point to the most of the patients, male and female disorders as well. When the person is complaining, when I just check the pulse diagnosis, I read the entire concept of the disease most of the time. You remember, up to 80% of the problem we can read through the pulse analysis. That is the concept. There is the short-term course, but you have the long-term answer. This is my word. It says is acupuncture is something is the amazing, that you study not only the points, but you can recognize, you can understand the etiology, you understand the pathogenesis, you understand the onset of the actions as well. So that particular time, the triple warmer, once you place the hand, so that time it shows that, so we can read the entire concept of that particular patient, what they do have. Then the triple warmer is weakness is there. You remember the person having the bowel related disorders, there is the constipation. I'll come to know that a specific point. But this, however, the gallbladder also one of the role to regulate the bowel movements, because it is required, the gallbladder is essential to promote and to regulate the bile, so secreted by the liver is stored by the gallbladder, that is essential to supply to the duodenum. Duodenum is supplied, is the upper part of the small intestine. When that secretion to be taken place, that secretion, the lubrication given after the metabolism, after the lipid metabolism, after the digestive metabolism, after the lipid juices are secreted by the gallbladder and also pancreatic juices, when the metabolism is good, then the elimination also good. If it is not happening that, certainly there is the middle geo also affected. Remember, when there is the middle geo is affected, when there is the problem of the colon is affected, then the brain and then gut axis also affected. When there is the problem is in the brain is not only the problem, you remember it is connected to our abdominal system also. When the abdomen is good, then the upper geo also good. When the abdomen is good, when the lower geo also good. When the chi is good, because that's called as a post essence energy. Always I used to tell how we eat, so that convert in the form of the glucose, and also it converts glycogen and convert as a glucose storage, everything to be taken place through how we eat. With the support of this middle geo is good. Always you remember, this is the secondary, and this is as a software. This software is good, then the hardware also good. This as a hardware, this as a software, both are essential to regulate precisely. Therefore, this point is day-to-day clinical practice are used to regulate the blood flow to the shoulder region and also upper region of the neck region, upper region of the head region, upper region of the ear region. Of course, this is really great point. Now one is the key information. One more imperative is, when we apply this particular point, it's my clinical experience, when the person is suffering for the shoulder brachial syndrome, when there is the pain on the right shoulder, and then apply the needle on the left side, vice versa. When we applied in the contralateral side, that time we asked them to lift. Of course, if the frozen shoulder is some mechanical problem where there is something else, there is an issue. But however, there is the mild to moderate, there is the shoulder pain is there. That time you wanted to treat when there is the problem is on the Shaoyang meridian related area. So definitely when you are in dilemma, I don't know whether Yang Ming, Shaoyang, Taiyang, you wanted to apply when the patient is complaining is the shoulder pain, that time you just activate very strongly. If anyone having the pain on this region, of course, please come forward so that we can show the demonstration how that will be really useful to treat for the shoulder brachial issues as well. So when we wanted to do insertion will not work here until you don't activate precisely. That also is the key. Now I wanted to apply this SJ3. For example, when the patient is complaining, I do have the pain on the right shoulder. So that particular time I just do the activation. Now you just try to see that manual stimulation. Please come forward. So I just applied now SJ3 here. SJ3. Then later, once I applied, it's not possible. So just you have given the energy to that particular meridian. It takes, because the name itself is the EM meridian is the endocrine. Endocrine, it takes the time to get relief. But for that is required as a strong stimulation. When the stimulation, manual stimulation are called as a EA, electroacupuncture. That time is the strong stimulation we can bring the anesthesia. Even the cardiac disorders, even the appendicitis, even in the Colombo or the especially in the China, you understand the anesthesia is the super expensive. So that time to bring down the inexpensive, that means the people who are the financial inhabited or they don't have much, that particular time they'll do the anesthesia through the acupuncture by giving the strong stimulation. So now we ask them to lift the hand, slowly abduct the hand into the upward direction. Now I just applied here SJ3. Now the manual stimulation. Once you do the manual stimulation strongly, now I ask him to please uplift your shoulder. Slowly you just lift your shoulder. Adduction. Adduction is this. Abduction is this. Abduction of the shoulder. You just lift your shoulder, not like that. Take off to the 180 degree. Yes, good. Still this is the 90 degree. This 100 degree, 120 degree. Good. 130 degree, 140 degree. Good. 150 degree. Good. Bring further. 170 degree. Good. Until you bring the 180 degree. Still little more. Now it's the 180 degree. So this can be possible. This can be possible when the mild to moderate pain is there. You remember, in this way we do the strong stimulation. But by the way, patient feel the pain. Patient feel the pain. And be careful, when you insert the needle, there is a vein is there. That's the branch of the capillary vein is there, so that we shouldn't puncture it. If we puncture, that also get bleed. You know the pathology people, they extract the blood from this particular vein also. Please be seated. So this is the beauty of this angio 3. Right?